pelvic innominate inflare and outflare. The pelvic inflare, the ASIS, anterior superior iliac spine, moves inwardly and PSIS move outward. Means ASIS moves middle towards the midline, PSIS move away from the midline. And there will be internal rotation of the femur, and as well as your toe will be pointing out inwardly. If with the outflare, your ASIS moves away from the midline, PSIS moves towards the midline, and femur will rotate to external rotations and great toe will move outward. So now, how to identify the inflare and outflare? There are some tests available. I will explain to you. The first test, you can check from the posterior part of the pelvis. Number one, you can identify the PSIS here. Just to place your finger a little down, because when you analyze this inflare and outflare, the thumb should be moved freely. So I am placing my thumb below the PSIS. Now the first test, I ask the model to move the toes inside and outside. Can you move inside and outside? Move outward, yes. Move inward, outward. You can see the movement. When he is moving inwardly, it's moving internal. Means the PSIS moves outside. When he moves outside, the PSIS moves inwardly. You have to check in that left and right respectively. When there is no movement occurs, when is, for example, if you want to find out the outflare, this PSIS has to move inwardly. If not moving inwardly, then it will be positive. So you can check in the both legs respectively. And the other test, you need to keep the patients in front. You need to check the ASIS. In the ASIS, which is relevant to the umbilical. In the relevant to the umbilical line and the ASIS, if the inflare, the ASIS moves towards the midline, towards the umbilical, that there will be some difference between the right and left. If it is outflare, the ASIS moves little away from it. So this is the normal length from the umbilical. When it is moving towards inside, this is inflare. Moving outward, that is outflare. And one more examination you can do. So again you can check this from here also. Again the umbilical, you can place your thumb in the ASIS and place your index finger over the umbilical. You know the distance between the right and left. If the distance is very shortened, then it is inflare. The distance is more far, then it is outflare. That way you can check for the right and right side, inflare or outflare. Now I will explain about the treatment, how we can correct. Like I used to treat with the muscle energy technique. So how can we correct this inflare and outflare? In case if you found which is inflare, so what you need to do, you need to bring the pelvis to the outflare position. So in case the right side of the pelvis is inflare, you have to bring the leg to the flexions and make it external rotations. You have to place the heel over the opposite patella. It looks like our Patrick test, the same way. So what you supposed to do, you have to place the right hand in the opposite, like a contralateral pelvis, ASIS, to stabilize the pelvis. And the other side, you bring it that limb down to feel the restrictive barrier. If the restrictive barrier till here, then what we need to do, we have to ask the patient to lift it up. Means they have to move opposite direction. Can you lift this up? So you have to hold for 6 counts. 1, 2, 3, 4, 5, 6. Then again you have to press down. Again when you meet that barrier, tell the patient to lift it up. Give a force. 1, 2, 3, 4, 5, 6. This method you have to repeat 5 times. 5 to 6 times you can repeat, you will get a result. This is for inflare. if you found it there is an outflare, you want to reduce it, the same the right side, what you supposed to do, you have to flex the hip and little, you have to rotate externally and you have to put that knee over the opposite sides. So in these positions, what you supposed to do, you have to take little more further flexions and place it there and ask the patients to give a resistance to the other sides. Give a force, 1, 2, 3, 4, 5, 6, relax. Again, 1, 2, 3, 4, 5, 6, relax. So the same way you can repeat 5 to 6 times. So you will get, after the test, every test you can get to know the level. The level is equal now, then you have corrected. But this inflare and outflare, it is not abnormal when we walk. For example, when you are lifting the leg up, which limb you are lifting up, that innominate, for example, the right side unloaded, left side is unloaded, I am lifting the left leg. When you lift the left side, the innominate bone will rotate to inward, like inflare. It go to inflare, and other things goes, the opposite side goes to outflare. So where the load goes, this goes outflare. Where the offload, where you lifting, that is, this goes to inflare. This mechanism happening, but where that position will be held for due to the prolonged position, abnormal position, then it is that problem. So we can correct through this method. Thank you for watching the video.